An autopsy is a detailed medical examination of a body after death. It is also called a post-mortem examination. Its main goals are to determine the cause of death, establish the manner of death, and gather important medical or legal information. An autopsy may be performed for clinical, forensic, or academic purposes. The examination is carried out by a pathologist or a forensic pathologist.
Why are autopsies performed? There are several important purposes. A clinical or hospital autopsy can confirm or clarify a diagnosis, help us understand disease progression, and improve future medical care. A forensic or medical legal autopsy is used when a death is sudden, unexpected, suspicious, or violent. Autopsies can also support medical education and research. In forensic pathology, the manner of death may be classified as natural, accident, suicide, homicide, or undetermined.
The first step is the external examination. The body is carefully examined from head to toe before any incision is made. The examiner documents the clothing, jewelry, personal belongings, height, weight, body build, and identifying features. The skin is examined for injuries, scars, tattoos, discoloration, and medical devices. The eyes, ears, nose, mouth, and other external areas are also examined. Photographs and detailed notes are used to document the findings. After the external examination, the internal examination may begin. A standard incision is made through the chest and abdominal areas to allow examination of the internal cavities. The skin and soft tissues are carefully reflected to expose the structures underneath.
Next, the chest cavity is examined. The heart, lungs, and major blood vessels are evaluated carefully. The organs may first be examined in their original position. They may then be removed for a more detailed examination. Important findings are documented throughout the procedure. The abdominal cavity contains several major organs. The liver, spleen, kidneys, stomach, intestines, and other structures are examined. The organs are assessed for their appearance, structure, and abnormalities. They may also be weighed and examined in greater detail. When indicated, the head and brain are also examined. The scalp and skull are examined, and the brain may be removed for detailed evaluation. The examination looks for structural abnormalities, injury, bleeding, disease, or other important findings. Additional samples may be collected, including blood, urine, vitreous humor, and tissue. These samples can be sent for toxicology, microscopy, or other laboratory tests. Histology is the microscopic examination of tissue samples. Toxicology can detect drugs, alcohol, poisons, or other substances. Microbiology can help identify infections. Radiology, including X-rays or CT scans, can provide additional information, especially in trauma or forensic cases. DNA analysis may also be used when identification or kinship needs to be established. The autopsy does not end when the physical examination is completed. Laboratory results may take days or weeks and can be critical to the final report. After the examination, the body is carefully reconstructed and closed. Organs are generally returned to the body cavities, although tissue or organs may sometimes be retained for further examination according to applicable procedures and permissions. The pathologist then prepares a detailed written report. When possible, the report states the cause of death and the manner of death.
The findings may provide important objective medical evidence for families, doctors, and the justice system.
Let's review. An autopsy is a systematic post-mortem examination. The external examination comes first, followed by the internal examination, when indicated. Samples may be collected for laboratory analysis. Finally, the findings are documented in a detailed report. Autopsies remain an important tool in medicine and forensic science. Thank you for watching.